Howdy. Well, like it or not, HR1 or One Big Beautiful Bill, depending on how you want to refer to it, has passed. And that leaves us here in medicine with several challenges for the future. There was a lot in that bill, but if I speak specifically on the medical parts, let me speak about three things I want to bring up that are challenges for anyone involved in advocacy in the coming years. Number one, this bill did take millions off of Medicaid eligibility. Let me speak to the Texas congressman and the two Texas senators that if you believe that we should have the working poor who are largely taken out of eligibility, if we should have them off the public dole, then what would you tell them to do in order to get health coverage? They cannot go to the marketplace and buy a health insurance product, largely because the marketplace doesn't offer such a thing. And so therefore, I say to you, we need health insurance reform almost as badly, probably more severely than we need health care reform. We need to have insurance products that are low cost for healthy working poor, and the marketplace just doesn't offer that. The employers are not offering that. So we need health insurance reform, and we need your intervention to make products available for those who are going to leave Medicaid. This will push a lot of the burden of this cost to states, and that's disconcerting, and the states don't want that either. So we need a better fix, and we need to have better private insurance reform in the wake of this. Number two, you look at the issue of medical student debt. This bill caps the amount of federal subsidized loans that a professional school student can take out at $50,000 a year for a total aggregate of $200,000. And many students have to take out more than that to go to medical school. And we don't only want the rich to be able to afford medical school. So to that, I say both Congress and medical schools have to step up to find a way to fund those students that are going to meet that maximum. I think medical school is too expensive, and maybe this will be a challenge that we need to have some innovation in terms of medical schools providing funding for students such that they don't have such big loans, but it's going to be a major challenge. And the third is this bill emerged without a doc fix, and that was to tie physician reimbursement from under Medicare to inflation. Physicians haven't had a raise since 2000, and with the effective inflation rates, that's been a tremendous decrease in payments through Medicare. That's challenging. That's why seniors have a hard time finding a doctor. It's getting harder and harder to get in to see a physician, and just with Medicare. It's a private practice killer because private practice physicians rely on those payments, and hospital-based physicians have other ways around that they can get reimbursed without feeling that brunt. So we need to have a doc fix. We need to have our physician payments tied to an inflationary index like hospitals and like physical therapists and everybody else in healthcare gets. We need a doc fix. Those are our challenges for the future. We sure have